Good day. I'm Rob LaRue, President of National Farmers Union, and thank you for logging into this discussion today about how we can encourage our friends and families and neighbors to get vaccinated. We're happy to share this message with those of you joining us live as well, and would encourage you to share those with others with the recording. We've all felt the impact of the pandemic in very different ways. For many of us, it's affected our own health or maybe the lives of some of our loved ones. We're now at a point when more than half of the country has received at least one shot. But we all need to work together to better protect our communities and our country. We know as Farmers Union members that infrastructure in rural communities can often lag behind that of our urban counterparts. This is particularly true in the access to healthcare. For example, as many of us know, rural hospitals are chronically underfunded and understaffed, and more than 125 rural hospitals went out of business over just the past decade. Ongoing impediments to mounting a swift and effective vaccination and public health information campaign point to the need to improve the entirety of our healthcare infrastructure. In the meantime, those of us who want to help, can help, should connect our friends and families with good information. We can discuss the topic in a way that will help them feel confident in getting the vaccine and protecting our communities. So even though the COVID-19 infections may have reached their lowest point since April 2020, rural parts of the country have lower vaccination rates than elsewhere. According to the latest analysis of vaccination rates by the Daily Yonder, an online publication that covers rural issues, vaccination rates in non-metro areas lag behind those of rural counties by about 9%. It's clear that we have some work to do. Today, I will be joined by three speakers, along with dozens of Farmers Union members joining us right now, and we hope many others who will share this information again with your neighbors and other members. During this webinar, please submit any questions you'd like to ask with our speakers in the Q&A box at the bottom of the screen. If you have any technical issues, please feel free to reach out to the NFU staff who will be monitoring, and you can use the chat box below for that. After our speakers make their presentations, we'll turn to the comments as well as your questions. And joining us today, we have Carrie Cochran-McLean, who is Chief Policy Officer, National Rural Health Association, Doug Somke, President, South Dakota Farmers Union, and I might check if Dr. Cameron Webb, Senior Policy Advisor for Equity on the White House COVID-19 response team, has been able to join us yet.
I'm here. Hello.
Great. Let me just give you a quick introduction of Dr. Webb. We really appreciate your time today and sharing your expertise here. Previously, Dr. Webb was an assistant professor of medicine and public health sciences and director of health policy and equity at the University of Virginia School of Medicine. A general internist, Dr. Webb worked in the university's COVID unit since the beginning of the pandemic. He is the founding director of UVA's Health Equity Law and Policy Research Laboratory and is a faculty member at the university's Equity Center. Prior to joining the faculty at UVA, Dr. Webb spent a year as a 2016 White House Fellow in the Obama-Biden administration's Office of Cabinet Affairs, where he served on the My Brother's Keeper Task Force and the White House Healthcare Team. A born and raised Virginian, Dr. Webb received his BA from the University of Virginia, his MD from Wake Forest, and his JD from Loyola University in Chicago. Dr. Webb, it is our honor to welcome you to the conversation today. Let me turn it over to you.
Awesome. Well, thanks so much for having me. I'm excited to join you all this afternoon. I apologize in advance if I'm kind of squirming around in my chair. I strained my back, and I had my 38th birthday on Monday and then strained my back today. I think it's a sign that I need to change the way I work out at the gym. But in any case, it's great to be with you. What I wanted to do over the next couple of minutes is talk to you a little bit about how we're looking at this pandemic, specifically in rural communities, and some of the best messaging, some of the best ways that we're communicating. And I'll start by saying that, even though these days I live just outside of Charlottesville, Virginia, in Albemarle County, from a rural county in Virginia, and my wife is from a rural county in Virginia. And I think that, those experiences have really helped shape the way that we look at healthcare. I think the hospital where I work at the University of Virginia serves a pretty large catchment area of other rural communities. And I think it's so important that we keep that at the forefront in so many states and so many communities, the real challenges, unique dynamics, and the mechanisms to reach and communicate with folks from rural communities. That really is, it absolutely has to be a key. And when we talk about equity, my role these days is Senior Policy Advisor for Equity on the White House COVID-19 response team. We're talking about race, ethnicity. We're also talking about place. We're also talking about disability status. We're talking about age, and we're talking about so many different factors. But when I say place, we've been focused since the beginning on how we can make sure that the rural communities are getting the resources necessary, and we're tailoring and having a culturally appropriate approach to engaging rural communities in the response effort. And so thank you for those of you who've helped participate in roundtables that we've had or provided feedback and insight, because it's been the key to the work that we've been doing thus far. So really, what I want to do is talk about a couple of the key insights that we have first into how to communicate and how we are communicating in rural communities. And then finally, I'll walk you through some of the key messages that we're using and how those messages have been effective. Also, I think it's really important to note that we can't frame the vaccination effort in terms that are appropriate for January 2021. Right. The fact of the matter is we're in June. People are in a fundamentally different place in communities all over this country. And so we do have to make sure that we're not using stale or outdated messaging, that we're really talking to folks in the current moment. And that's our best way to get the job done. So in terms of the key insights, there really are about 7 that we found are critical to our understanding the best ways to communicate. The first is this notion of acknowledging rural populations' focus on individual responsibility, respect for family, and commitment to community. And that's so key to framing our conversations around COVID-19 vaccines. That's absolutely a hallmark of so many of these communities. It's something that creates that really unique dynamic. It's part of the reason why we love going back to Appomattox, Virginia, almost every other weekend to visit my wife's family, because that's the community notion. That's the experience that they had. And when you focus on the impact of this pandemic through that lens, you're going to keep people's ears open a little bit longer. The second insight is that, you offer more information about the benefits of vaccination as opposed to the warnings or describing consequences. Again, carrots, not sticks. And that's a really important way for us to look at this, is to make sure that people are seeing that vaccines offer advantages to those individuals and to their families, as opposed to saying vaccines help stave off, bad outcomes. And the third is so important. And this is something I've learned in my medical practice over the years, and it is so critical, and it's to not dismiss or minimize concerns about the vaccine. When people do engage with concerns, whether it's rooted in real genuine concerns or sometimes in misinformation or myths, you still have to acknowledge that it's normal for people to have concerns or questions about vaccines and provide fact-based responses about vaccine safety and effectiveness. Those are just kind of a tried and true way of doing engagement in healthcare in general. But I think that beginning by acknowledging somebody's concerns and then giving your response is such a key. The fourth is encouraging people to seek advice from a healthcare provider if they have doubts or concerns about the vaccine. We found that, just leaning into the statistic that more than 90% of physicians have selected or chose to be vaccinated themselves. That's a helpful data point. It actually opens a lot of ears, and folks say, well, if it's good enough for the doctors, why maybe I should think about this too. Those are the ones who know the science pretty well. And also, it's easier if you don't talk about, healthcare providers as some kind of national phenomenon. People don't necessarily like healthcare or doctors in general, but they like their doctor. And so it's so important to encourage folks, say, here's some information I have, but talk to your doctor, and they'll probably give you some similar insights, or they'll probably tell you how this could serve you. And so really make that encouragement. The fifth insight is that, we really like to lean into this idea of the freedom that vaccination allows. And that's both, with regard to travel, and we're seeing all over the country, and also when people are traveling in other places, that's a big deal, but also allowing small businesses to thrive. So that's a freedom that we see that's really important. And that's a framing that's really helpful for folks. The sixth is to use facts from credible sources and keep politics and emotional appeals out of the discussion. So, the idea that family togetherness is less likely to influence vaccination, since, in a lot of rural communities, folks are less likely to have a deceased family member over the course of this last 16 months. And so it's really important to really keep it framed in a very fact-based, credibly sourced conversation. And then finally, there's this dynamic that I think is worth your awareness, which is that rural communities as a whole are more likely to have started to believe or heard that it's possible the threat of COVID-19 has been overstated, both in the past and presently. I was in one community down in rural Alabama, and one thing that I heard, this was just the other week, was that when you talk about getting things back to normal, somebody responded, things have been back to normal here since last June, and so when you hear things like that, you recognize that that's a fundamentally different experience with COVID-19 than what you're seeing in so many other communities. And you have to change your posture. You have to say, look, it's not that COVID has been over since last June. It may be that there's a different experience you've had locally or within your family, but that doesn't mean that it can't change in an instant. And we pointed to so many rural communities, if you go back to last summer, that suddenly had a high number of cases. In July and August, that's when the rural death rate exceeded the urban death rate. That's when rural cases exceeded urban cases. And I think that that's so important to point to folks that, listen, as the rest of the country gets more and more vaccinated, this virus is still going to find somewhere to go. And if it finds its way into your community, there are 5 weeks from getting the first shot to being fully immunized against COVID-19. And is your community ready? Are you ready for that chance? And I think for some people, again, taking a real fact-based approach, but for a lot of folks, what they say is that, it seems to them that a lot of the concerns about COVID-19 have been overstated. And I want to be clear, a lot of that is also connected to this notion that there's a politicization of this pandemic. People are using it to scare folks or to advance other agendas. And that's really a common perception among a lot of folks in a lot of communities, not just rural communities. I think it's important to just shoot people straight. And so just to bring it to a close, I want to leave you with some key messages. And again, these are 6 key messages. They're themed. And so I think they'll be helpful for you. You always, in your conversations, in your communications, really frame the conversation around COVID vaccination in these 6 terms. And those are safety, the benefits, effectiveness, and then the development, and then finally choice. So those are and so that's 5 actually. So those are the 5 key messages I want you to take. So the first is safety. Certainly talking about how these vaccines were authorized for use here in the United States, and they're authorized, yes, for emergency use, but with the highest safety standards in mind, that millions, over 175 million Americans have received at least 1 shot, and the vaccines continue to undergo the most extensive safety monitoring in U.S. history. And that the CDC recommends getting the vaccine as soon as you can. That's the safety framework. It's important for people to hear, but you don't want to spend all of your time in the safety framework, right? It's just a level set for folks to understand that they are safe. And the next thing is that they're effective, right? And so the FDA authorized vaccines, they can keep you and your family safe from COVID-19. And in the clinical trials, of course, we saw really nearly 100% prevention of hospitalizations and deaths. So that shows very effective. But also, that COVID can have serious life-threatening effects on you no matter your age. I often talk about stories or experiences that I've had in my hospital and working on the COVID unit. And I tell the story of a 25-year-old person with no prior medical conditions who was one of my patients last May. And I remember him coming in asking, Doc, why am I not able to breathe? I don't have any medical conditions. Why is COVID doing this to me? And I ended up having to send him to the ICU. He was in the hospital for almost 2 months. And when people hear that story, they're just like, this happened to a healthy 25-year-old. There must have been something else wrong. And I tell them, I can assure you there was nothing else that we knew that was wrong. This kid had no underlying health conditions, no underlying breathing challenges. But that's what this virus has done. And so we know that for folks who've been vaccinated, they don't end up getting hospitalized. They don't die. And that's the reason why our death rates have dropped so much. And so the effectiveness is clear. The data is there. The data is really strong. And so it's kind of like an insurance policy. You don't want to get into a car accident. You don't want to get COVID. But if you do, the insurance here is the effectiveness is that if you got COVID, you're not going to die. You're not going to be hospitalized. That's how these vaccines, that's how effective they are. In terms of the benefits, we talk a lot about returning to normal. And again, you have to really think about the community that you're engaging. Some folks have returned to normal activities a long time ago, but keep in mind, it's, engaging with other vaccinated people, with other vaccinated folks with some peace of mind, or even connecting with family members who may live near or far, going around without masks, again, without the concern that you can unknowingly be putting yourself at risk, not needing to be tested for COVID, which if you've been tested, it's not a pleasant experience. And so I think for a lot of people, that's one of the things that's valuable. And then we talk about getting folks back to work, back to school, or back to spending time with family at holidays and other moments that are important. So that's the benefits side of it. The last two, like I mentioned, development and choice. So on the development front, we do talk about the fact these vaccines, people say it happened fast, but we talk about this played out over a dozen years, that mRNA technology. This played out, over the last 5 years, this research around COVID or coronaviruses rather. And when you put them together and you accelerate with an extensive federal investment, that's how you get vaccines as swiftly as we did in the setting of a real emergency. And so I think that it's just that you had a lot of research on two different fronts brought to a head at the right time. But it's also important to always note, and I've had so many people tell me this is the one point that was the most important for them to hear, is I say no safety steps were skipped in the development of these vaccines. And they're just like, that's really important. So it happened quickly, but it's not because we cut corners on safety. It's because, and I think this resonates in rural communities, we say we got rid of some of the red tape, some of the unnecessary things, or we helped, speed things through the bureaucratic process, but the safety pieces were always there. And in a lot of rural communities, folks will say, we shouldn't have those bureaucratic processes in the first place. And I say, yeah, these vaccines, they make a good case for that, right? That we can do some good things without some of that bureaucracy. And then finally, choice. I always end with the same line. And I say, look, I'm not here to sell you a vaccine. I'm here to help end a pandemic. This ultimately is your choice. And you can choose to help us in this pandemic by getting vaccinated or by continuing to wear a mask and maintain distance and use those mitigation measures. One of the two. But those are the two ways that you can help us as Americans end this pandemic. And then you're giving folks that choice, right? Those are the two options they have to choose from. And for a lot of folks, they see that vaccines, hey, I'll just get it over with. It's over and done. And that's a good thing. So, hopefully that's helpful to you. We spent a lot of time, had a lot of conversations. I continue to have them every single day. We always want to know how we can reach people, connect with people better. I really want to encourage you in your conversations, in your interactions, make sure that you're being very clear with folks. It is their choice, ultimately. They have that autonomy, that freedom. It's their choice to make. We just want to give them the information, the insights, and the perspective to make a choice that's the best for themselves, their family, and their community. And so with that, I will turn it back over. Thanks so much for allowing me to join you. And hopefully some of that information was helpful to you.
All righty. Thanks so much, Dr. Webb, for that information. And, especially appreciated the emphasis on fact-based information, and keeping it relevant to the community and where folks feel safe already with their local experts. So really appreciate those thoughts. As a reminder to everybody, please, if you have questions for our panelists, to make sure to use the Q&A box down at the bottom of the screen. Our next speaker is another fantastic rural health expert. Carrie Cochran-McLean has nearly 20 years of experience working in federal health policy development, including time as the Director of Federal Office of Planning, Analysis, and Evaluation for the Health Resources and Services Administration. She has served as the Deputy Administrator of the Federal Office of Rural Health Policy from 2006 to 2010. Today, she's with the National Rural Health Association, which works to improve the health and well-being of rural Americans and to provide leadership on rural health issues through advocacy, communications, education, and research. NRHA has been an important partner and resource to Farmers Union, as we have worked together on a number of issues, including addressing the mental health challenges among family farmers and ranchers, as well as confronting this pandemic. Thank you for joining us today. I'll turn it over to you, Carrie.
Great, thanks, Rob. I'm delighted to be here. And even though it's late in the day, hopefully I can successfully share a couple of slides here with you all for a little bit of extra context and a resource for you. So yeah, as Rob said, I'm with the National Rural Health Association. Rob told you a little bit about us, but the way I like to describe us is that we have more than 21,000 members made up of organizations and individuals, and we have a very large tent. And all of us under it care about improving the quality of rural health in our communities across the country. And so today I want to talk to you a little bit, I'm going to share a little bit of data about what COVID is looking like still in our rural communities, and then talk about some resources available to you as you have these conversations around COVID-19. You know, Rob started out by saying we are at a low for COVID infections in our communities, and thank goodness for that. But there are still very much pockets where we are seeing people get newly infected, and especially in rural areas. And as we think about the new Delta variant starting to roll out throughout the country, it's really important that we don't let our guard down. I know we're all so tired of the changes that have happened in life, but unfortunately, we're not kind of free of this virus yet. And so as we talk about vaccinations, I think it's really, this information is by state. It's also from Daily Yonder, which Rob referenced. There's similar information by county on the CDC website. But you can kind of see from this map, the darker colors mean that the rural population, it has higher vaccination rates, and the lighter the color, it means those vaccination rates are lower in the rural populations of that state. So still a lot of work to do kind of in the what do we call that? The central mid-Atlantic, sorry, it's even where I live and I'm spacing out on it. The mid-Atlantic part, and then kind of the southeast across the southern part of our country, making sure that we really are kind of having these conversations. NRHA back in March, and we know that as Dr. Webb said, you know, March of the pandemic is different than June of the pandemic of 2021. But back in March, we partnered with the Chartis Center for Rural Health to do a survey of rural healthcare providers, specifically hospitals in rural communities across the country, to see where they are with vaccinating just their personnel. And what we found is that there are still a number of healthcare facilities in the country where these conversations are happening. And they're happening not only with doctors and nurses, but with kind of the broad range of staff that may work in a healthcare facility. And you can see this chart's a little bit confusing, but you can see from it that there were still quite a few respondents that had pretty low percentages in terms of their populations being vaccinated. And to me, that says, you know, if I am in a community and my cousin or neighbor or whomever works at a hospital and they haven't gotten their vaccine, it's going to kind of create some questions on my end. And so as we have these conversations, I think it's, you know, we're going to be looking to kind of our trusted resources in the communities, figuring out kind of the reasons we would want to get vaccinated, the reasons we might have concerns, and just having those honest conversations. And in the survey, we found that the main concerns were around kind of being able to make that personal choice, as Dr. Webb said, and understanding that it really is a personal choice. We don't want people to feel pressured into this. Making sure that they understand kind of the process that the vaccines did go through, and the science base behind it that both Rob and Dr. Webb mentioned, and the safety associated with that. So I think understanding where people's concerns are coming from really helps us to have those important conversations. So NRHA, there's so much out there right now on vaccine and COVID and outreach. And so we partnered with folks in the rural world to make sure that we had messages that really are targeted and specific to rural communities and things that will resonate with our neighbors and local businesses and others. And what we found, and you can see this is hyperlinked, so when Mike and others share the slides with you, you can go to our website and find this talking point kind of 2-pager. But what we found is that a focus on the facts, right? The way that these vaccines were developed, their efficacy, their safety. I think an important piece that you don't always hear is that they're free of charge. No one has to pay for a COVID vaccine, period. Right. And so while you might be asked to share insurance information, the vaccines are free of charge, and no one should be concerned about that part of it. So it's kind of that evidence, scientific, fact-based part of the conversation. And then to kind of what Dr. Webb was saying, that getting vaccinated and taking care of those in your community, it protects your local businesses. We all know how hard it was for ourselves and our neighbors when the world basically shut down for a period of time. And we want to make sure that businesses are able to stay open, and that those people who are interfacing one-on-one within our communities, be that in a healthcare setting or in some other setting, are able to do their jobs safely. And so you're really protecting the local economy when you're getting your vaccine. And lastly, that message about protecting yourself and the people you love. And it is a personal choice, but what a good reason to make that choice, right? Is to making sure that that you're doing your part to protect your family and those around you, and that really seems to resonate with people as well. In addition to the talking points, we created an outreach toolkit specific for rural communities. Again, thinking about who are the trusted leaders within our rural communities. And in addition to those in a broad range of kind of healthcare settings, we identified faith leaders and ag leaders, all of you, as people that really folks look to in their community for leadership and for information on important decisions. And so based on that, we created a whole series, or identified, because a lot of good work had been done, but it's all, we kind of curated it to give talking points, fillable templates, including op-eds, social media, PSAs, posters, things you can put your own logo on. I know we're talking a little bit more about the one-on-one conversations, but to the extent that you want to help kind of share that message in a more kind of global setting, those resources are available to you. And there's also material on how to assess what the concerns are in your community. Where are people getting, what information have they heard that's making them concerned or hesitant? And then some of this, the data and pure science fact sheets about the vaccine and the virus that you can tap into. And all of that is available on our website. We also have resources for rural providers who may need technical assistance with a number of aspects of COVID-19. And then linking to the federal campaign, in case there are any organizations out there who want to join up with that. Dr. Webb can probably answer questions on this too, but the administration has created the We Can Do This public education campaign, and that community core has a whole bunch of on the ground kind of resources and training available to organizations should they want to do something in their local community. And with that, that's my contact information, and I look forward to the Q&A portion.
All right. Thank you so much, Carrie. And what's nice is that, we're also seeing, shouldn't be a huge surprise, but these themes that carry over between your presentation there and Dr. Webb. But, again, really an emphasis on making sure that there's factual information to supply and where folks can access additional information if they need to verify. And then really stressing that tie to the local community, and whether it's farms and their family businesses there at the farms, or the businesses that their family members may be working in, or other community members, all that making sure that the local community can remain resilient and protected is really a nice touch. So thank you for that and for sharing all those resources. At this point, we will turn to our third speaker. As a reminder, please feel free to use the Q&A button at the bottom for any questions. Doug Somke, though, is the president of South Dakota Farmers Union. He has served as president in that role since 2005. He's worked to support South Dakota's family farmers and ranchers and give them a strong and reasoned voice in Pierre and in Washington, D.C. Doug knows the importance of community organizations and the influence they can have. He's a busy man. In addition to his role as state president, he has served in a leadership capacity for the East River Ropers, Fernie Centennial, the Brown County Wheat Board, St. John's Lutheran Church, and the Fernie Farmers Union Cooperative. I might add, this is very typical, right, for a lot of ag leaders. They are extremely involved throughout their community, so many of us can relate. Doug, thank you for joining in today's discussion and for helping us learn from your experiences.
Well, thanks for having me, Rob. I tell you, following those two and their important message as doctors is a heavy responsibility, but I'll do the best I can. I know when Mike called to ask me to speak, he just said, you guys did a good job sharing the message and a lot of it. And so, what got us to this point? Well, for us in South Dakota, especially, we're a state of less than 1 million people. So everybody's your neighbor. Somebody who knows somebody that either had this terrible disease or has passed away from it. And it was quite personal early on for me because the legislator that passed away early on was from Huron, worked with him several times in the legislative process. And he was the first person that passed away from this terrible disease in South Dakota. So it hit hard and personal right away. But not only that, we had a former board member that just retired here a couple of years ago, and his wife passed away. We've had other members of our membership that had similar things. Either their wife or their husband passed away. So, and in Farmers Union, especially in a small state like South Dakota, like I said, we're all family. We all care about each other very, very much. And we even had one board member that was in his 40s that had a very close call beating the pandemic. And he was in the hospital for 40 days before he finally was able to come out. And so again, like I said, it was very personal. And so we decided that, we needed to get the word out and do the best we can to keep it from being political. And also, as Dr. Webb pointed out, not to be pressuring, just that, we care about you, we love you, and we hope you have that same amount of love for the rest of us and for your community. And I compared this to my father, who had polio when he was 16. He came down with that horrible disease, and look what we were able to do because we aggressively attacked that disease. And my dad had symptoms of the polio, very severe, affected his whole left side, his left arm, his left leg, his left lung, and his left kidney. So he suffered this the rest of his life. And these are things that, at 16, he didn't realize that things are going to be this bad for him all his life. He passed away here a few years ago, and they were contributing factors of his problems not being able to breathe. So we don't know what those factors are going to be yet. I mean, it's still early. We don't know, but we do know from people that have had the disease that there is a bad outcome as far as lingering effects. I just spoke with our board member yesterday that had the disease, and he said it felt like he was drowning every day for them 40 days. And there's times, even now today, that it reoccurs. There's certain times symptoms come back. So again, you know, we don't want to see that happen to anybody. So that's why we put a huge press on getting the message out. We did everything we could with social media. We held as many press releases as we could to get the word out. And then, you know, the other thing is we just ask people, you know, as Dr. McLean mentioned, you know, care about yourself and care about your neighbors. And that's really what it comes down to, folks. It's not about that you feel like you have to pressure them. And I hope that we never made anyone feel that way. But I've been very fortunate because my family, I've got several family members that work in the healthcare field. That my daughter works in the healthcare field. I got two daughter-in-laws that work in the healthcare field, and another one that's a vet. So they all understand the you know, following the science and why science is so important. And it still bewilders me, even us as farmers, you know, that you know, we trust a doctor or vet to tell us what is wrong with our livestock, but yet we still have a hard time understanding why we don't want to you know, fully embrace this vaccine. But it's, again, it's a pressure thing. I believe. I think a lot of people see it as you know, I'm tougher than this, or I'm not tougher. You know, that guy's tougher than me, whatever. But the sad thing is, we had several rural communities here in South Dakota that don't have a lot of people. I mean, maybe 200-300 people. And just about everybody in that community ended up getting the disease at one time or another. And that's the sad thing is, even though we're sparsely populated, when it does hit you, it hits you hard. And our community of Huron was hit very hard, and it lasted for a very long time. As a matter of fact, it's still not over there, but it is better than some of the other communities. But we're trying to do a better job. We're trying to get the message out, and I think, you know, just talking, that's another big key. I mean, as both the doctors pointed out, you know, it's the trusted individuals, it's the leaders in the communities that if you can get their backing and their blessing, that it does really work. It's worked here anyway. And I'm not going to say it's anything because it's just what we did. You know, we are coalition builders with other organizations as well. And, you know, that all makes a big difference. So that's about all I have, Rob. I mean, I guess I'm really looking forward to, if there's any questions about the doc. I really appreciated the points that both doctors pointed out. I think there's a lot of good information there to take home to help us continue to get the message out.
Alrighty, thank you so much, Doug. And really kind of that just message of not only Farmers Union members, but all the members of the community really feeling like family in some of these really small rural communities, and expressing among everything else a love and a desire to make sure that folks are safe. So connecting them with good information and resources, you know, hopefully is continuing to help. At this point, we do have a few questions for our speakers. Please feel free to continue to put questions in. But one of the first questions actually has to do with young adults and teenagers, and whether or not our panelists might have information that would be useful to helping to encourage vaccination among that particular population. If there's information that's tied directly to rural youth, that's great, and young adults. But any tips generally that folks have?
Yeah, I can speak to that some, but first I just want to say, Doug, thanks so much for your comments and for bringing that home, making it so real and personal. I think that's really what people need to hear and need to see, and so I appreciate you kind of sharing your own perspective. For young folks, it's really two messages that tend to hit the hardest. The first is is protecting the things they care most about. A lot of young people missed out on their senior year of football or basketball or any sport, right? And that's a huge deal. A lot of folks didn't get to go to high school dance or whatever it may be, and those lost experiences to a 16 or 17-year-old, that feels like your whole life, And so I think that really impressing upon them that just because we've made the progress that we've made doesn't mean that we can't see, the pandemic rear its ugly head again. I mean, I think the truth is, in communities that have lower vaccination rates, they very easily could have a surge in cases at some point in time. And so really the first thing is, this helps protect your next year of high school or your first year, after high school or whatever it may be. So that's one reason. And I think that the other is, and this one actually has been incredibly effective, it's that COVID, for lack of a better word, COVID sucks. It does some real damage to folks, even mild cases. And so what the data is telling us is that it causes damage to your heart, your lungs, and your brain. Even mild cases can cause that kind of damage. Over almost a third of individuals who have a mild case of COVID can end up having lingering symptoms for a couple of months. And for a young person who's never been sick before, the thought that they can end up having symptoms for months, they're just like, I don't want any part of that, So I think the lingering effects on lung capacity or on the heart with rates of myocarditis from COVID, or on the brain with the mind fog that people have, the loss of sense of taste and the loss of sense of smell that can linger for months, that those are good reasons for young folks. And so, I start there, but then I also just remind them that, look, it is your choice, but understand this is the reason why it's effective. And then reminding them COVID can affect anybody, not just older populations. So just really making sure they're clear on that.
Great. Anyone else want to chime in there on the adults and teen population? Dr. Webb, I think you kind of nailed it. It sounds like, particularly for the impact on their lives and their world around them, and then also that potential health impact. I might ask if there is any information on outreach in this messaging around vaccination to rural but non-English speaking residents. Within a lot of these farm communities in particular, we may have folks there, farm workers, others, folks who are in processing facilities, many who may be non-English speaking. We know that sometimes there are other very inherent challenges in terms of access to healthcare in general, but in terms of protection here with the vaccination, any information you can share on resources that might be available?
Yeah, I'm happy to speak to that too. And Carrie, if you have something you'd like to add, certainly. But from our perspective, really two things to start with is federally qualified health centers. A lot of them serve some of the larger, migrant worker populations. And since we saw that early on, those were the first federally qualified health centers that we gave doses of vaccine to, were those that served larger migrant worker populations. Then, because the name tells you exactly how they work, as migrant populations, they're in some states January through March, some other states April through June, and we see that movement. And so we actually paired in a quarterly fashion where we're sending doses to match that migrant population, and we're doing corresponding outreach. So those federally qualified health centers had a burst of doses to correspond with that migrant population. But then the other thing, even beyond that, you have to address the concerns that people have. People have concerns about whether or not the vaccines are free. Carrie mentioned that you have to say they're free, not kind of free, not maybe free. They are absolutely free. And that helps to relieve some of the concerns. Some people have concerns about, even immigration enforcement and letting folks know there's no immigration enforcement at these vaccination sites. And the reason isn't political, right? The reason is simply that if you're in this country, you can get COVID and you can spread COVID. So you need to be vaccinated, right? It's and I think that kind of removes the politics from it, but it also reminds folks, look, if you're here, get vaccinated because we don't want anybody spreading COVID. So I think just, speaking to those challenges and making sure that people know they have access, making sure that they know they can get it in, and that it's not going to cost them anything, that makes the biggest difference.
Yeah, and I would add to that. I see Natalie Roy with AgriSafe has some comments, chats going in the text box. But so 2 resources I was going to flag specifically targeting or looking at kind of the agricultural community and agricultural workers. AgriSafe has done some great work. On-demand webinars and other resources looking at kind of this population, and Natalie has posted some of the YouTube videos that have Spanish translation in her in the chat there. Also, the National Center for Farm Worker Health has a really robust set of kind of outreach resources, social media documents, radio files, everything in multiple languages that are really terrific for kind of that migrant population community. You can find links to both of those things on our COVID toolkit. I put that link in the chat earlier. So I would recommend both of those. And the other thing I would emphasize that Dr. Webb said is, in addition to, you know, I think one of the things we've heard and really resonated is trying to work with like a promotora and community health worker, kind of getting linked into that population within your communities can sometimes help reach migrant workers and others, and really talking about how no data is collected other than kind of your name so that they can help track the vaccine, but there's no similar to kind of the financial piece of it. I think people are afraid they're going to have to turn over a lot more information than they really do. So it is a safe process in many ways.
Yeah, thank you. And actually, just, you know, again, another shout out to Lisa, Natalie, and other participants here for continuing to share resources there in the chat. We'll make sure that those are available to everyone here. It takes a community, right? And that's what we're trying to do here as well. Doug, some of the issues that you were talking about confronting, and the other speakers mentioned this as well, is right the what seems like an overwhelming amount of misinformation out there that we have to push back against. And I was wondering if you, and I might, you know, invite the others as well to talk about your experience in either pushing back on that or deflecting and making sure that there's access to information. I know we've heard some of the speakers talk about, you know, it's perfectly natural to have concerns and to want information. But any tips, tricks, or other guidance you might give for kind of combating misinformation that comes into the conversation?
Yeah, that's a good question, Rob. You know, what we found worked, you know, pretty much goes back to what Dr. Webb was saying, you know, about staying on the safety side, you know, and of course there's concerns. Should we all be concerned about a new vaccine that comes along so quickly? Of course we should, but don't believe everything you read on the web. You know, I mean, get it from, you know, resourceful places. Don't just be grabbing something just because it agrees with your narrative. And the first question that I would always ask anybody is, where did you hear that? And if it wasn't from a reliable source, they admit pretty quickly that, well, it was something that I found, you know. And you know, and again, not trying to belittle anybody, not at all. I mean, it's the fact that we just all got to be truthful with ourselves. And again, you know, the benefit side of it, and realize that, like Dr. Webb said as well, this has been researched for, you know, a decade already to get to this point as quickly as we did. Thank goodness for that, right? I mean, again, I think this really strongly emphasizes on why we have to do such a better job of research and development for things for our safety and health of our own individuals. We for whatever reason, we've monetized everything, and we just criticize, you know, good facts and good things for human nature. I don't understand that, but that's what we as Americans do, and you know, we want to make money on everything, right? I mean, but first of all, let's save everybody. Let's save as many people as we can. That's what we're put on this earth for, is to care for each other.
That theme, Doug, of continuing to caring for each other. Dr. Webb, Carrie?
Yeah, I mean, I completely agree. I think that somebody asked me the other day, they said, if you had one, or what is the one thing that you say to people that's the most effective at changing their minds when it comes to vaccines. And immediately I said, what questions do you have? You know, I think flipping it and turning it into a space where people can share their perspective rather than talking at people, that's the key. And as Doug said, you will hear things that come from the dark corners of the internet, and people do get a little sheepish where they're like, I heard it turns you into a magnet, you know, and you're just like, okay, well, I saw that on Facebook too. And let me tell you there's no scientific basis. In fact, and then I talk about how, like, let me tell you the ingredients that are actually in this vaccine. You know, it's just the mRNA. It's a lipid layer that stabilizes the mRNA so it can get to the cell. It's salts so that it matches your body's pH and doesn't dissolve on its way to the cell. And then it's sugars so that the lipids don't stick together when it's at cold temperatures. That's what's in it, you know? And then people are just like, yeah, but what about the metal content? It's like, there's not enough metal content. You have iron in all of your red blood cells. There is not enough metal content, period, anywhere close to it to change the metal composition of your body. But, you know, it's just like people are asking questions. It's like, hey, I understand. I heard that too. I saw that too. My uncle talked to me about that just the same. Let me tell you why I did the research that I did. And I'll tell you what I do that also works is I say, I heard that, I did the research, and I still told my mama to get that vaccine. And then people are just like, wait a minute. And I'm like, yes, even in the face of what you heard, my mama, who I love, who raised 6 kids and who I will swear by till my dying day, I said, if you will, mama, please go get that vaccine because it might save your life, you know? So I think when people hear that, they're just like, okay, that's something I can hear, I can process. It's not that he's ignorant to it, it's that he heard it, he assessed it, and he still recommended it for his family, you know, and that's a difference maker.
Yep, and I totally agree. I think it's making an environment where people can feel comfortable asking questions. I mean, I work in this field and I had questions when I got mine, you know, it's a natural part of human nature. There's nothing wrong with it. We all want to feel confident that we're doing something that's good for ourselves and again, for our neighbors. And so it's okay. It's okay to ask the questions and it's part of the process. And we want to encourage people to do that. So that would be my words of wisdom.
No, that's great. Probably on this and many other things, it's also just a reminder that we may feel one day, based on the information that we have, one way about an issue like this vaccine, but with over time, it may not be one conversation, but over the course of accumulating additional information, we change our minds, you know, when we have more information, and good information. So thank you guys. And I know that we have additional questions, but I unfortunately do need to bring today's conversation to a close, but I would invite all of us to make sure that we're continuing this conversation, right? This important work, making sure that we're connecting with the community, making sure that we are connecting good information and resources to that community so that they can make an informed choice to help protect their loved ones, their communities, the local economy, I've heard today. I mean, so many of those things that all of us want to do in our communities, that we have important ways that we can strengthen that. And so once again, a huge thank you to our esteemed panelists today, to Dr. Webb, to Carrie Cochran-McLean, to Doug Somke for sharing your stories, your experience with this, your resources, and another shout out to our participants here for sharing additional resources here. We plan to make sure that these resources are available on our YouTube channel, but also on our website. This conversation, please share it, and the resources that are contained here. Thanks everyone, remain safe, and let's keep our community strong. Take care.